Good afternoon. I am Elvis Tani Are, and this is my Applied Practical Experience presentation. What I'll be walking through is introducing the location where I conducted my APE, and then talk about the activities that I did while I was doing the APE, and then connect those activities to the competencies, and then conclusion and reflection. And then I will walk you through some of the appendix, which is some of the work that I completed while I was doing the APE program. So the introduction here, I did my applied practical experience at the Montana Department of Public Health and Human Services. So I worked in the environmental division as a sanitarian. So I was able to utilize that position to complete my APE program. So I had my supervisor, which was Stacy Evangeline. She was very useful and very progressive in terms of assigning me what to do and guiding me through the process. So the role that I did as a student was practically I was working at the same time completing my APE using the work programs that I completed at work. So some of the things that I wanted to cover during the work program was being able to have work products which have to facilitate an evaluation of policies and their impact on public health and equity. And then you talk about trying to have a clean environment in the community, because my department is technically environmental health department. And then I work on keeping up to date and updating some of the records that are in the system database, keeping the database up to date, editing, and making sure that if someone goes through to look for information, that should be up to date. So some of the competencies that I completed during the applied practical experience include the competencies number 13, which is propose strategies to identify stakeholders and build coalition and partnership for influencing public health outcomes. And the second one that I worked on was the competency number 14, which was advocate for political, social, or economic policy and programs that will improve health in diverse population. Then I also worked on competency number 15, which was evaluate policy for their impact on public health and health equity. And then I also worked with competency 21, which perform efficiently on interpersonal themes. That was very common because almost everything I did, I had to collaborate with a lot of the teams. And then I completed a competency 22, which was apply system thinking tools to public health issues. So the activities that I completed, one of the first activity that I completed throughout the program was administrative law training. So because I was also starting the job at the same time with my APE, I was able to also utilize the training process while also gaining those applied experiences during the program. So some of the things that I did in terms of study the Montana laws and regulation as they govern public accommodation, emergency preparedness, and food safety. In practical, that's also what I do in my real job. So I just utilize what I do in the job and the responsibilities that I have in my title as a sanitarian / environmental health specialist. So the input in this one was I was given a company computer and office, and then I was introduced into the state computer system with website and database to be able to study the state laws and regulation as they govern environmental uh, activities in terms of public accommodation, emergency preparedness, and food safety. So in this program, the implementation that I did was I did not really have an implementation for this one because it was mostly trying to get those laws, review them, and understand what they are, so that when I go out into the public, I should be able to do the job and apply the laws as and rules as they're written there. So that was the main goal, to try and understand those. And then in terms of output, is very much trying to be able to make sure that I have those rules and regulations in the back of my head and ready to go. And then the second work product that I did there was public policy review. So in this, I review public accommodation, emergency preparedness, food safety, current policies. So what I did on there was being able to look at where the job aligns in terms of the public accommodations. I want to be able to understand how that applies to hotels, bed and breakfast. I think other establishments that houses people, to be able to make sure that they meet the state and the state rules and regulations. And then in terms of emergency preparedness, being able to understand, reading through the emergency preparedness plan, also studying the IS, which is the FEMA programs that helps you kind of learn how to be an incident command and stuff like that, and be able to go through the step-by-step processes, knowing the organization and following those guidelines to help you through those kind of responses. And then in terms of food safety, you want to be able to know that restaurants and all food establishments are meeting the standards, especially if they have HACCP guidelines, or to make sure that the food they're producing and selling meet those health regulations. So the implementation in this case was going out there and being able to look at what the state have going. So I also work on truck racks, food truck racks in the state, and trying to update the database and making sure that it's up to date in terms of that. And then those outputs out there, I did generate some data to try to highlight where the system is lagging in terms of connections and communications in the state when there's a food truck accident anywhere in the state. And then the third thing I work on was making sure I updated the database, going in there and updating database on informations on public accommodations, drug regs, and also updating on emergency preparedness. And then in this, also, I went through and conducted a food safety audit inspection. I did one at a school, at an elementary school, and then I also did one using the casino facility. So it was part of my training and also part of the APE program to be able to carry out those activities and filling out the documents and writing the reports, and then uploading those information into the database to keep up to date the inspection reports and all that. And then when it comes to the competencies that I was able to go through, So on this competencies, which was proposing strategies to identify stakeholders and build those coalitions, partnership for influencing public health outcomes. In this connection, my work on drug rights involving food in the state of Montana was very critical. So I took one of the counties that there was an incident of ice cream popping out in the community on social media, people consuming the ice cream. And then it turns out there was an accident in one of the counties. It wasn't reported, so that truck ended up at a truck at a truck disposal tow truck at a tow truck facility. So the tow truck was didn't know what to do with the ice cream, so they put it out there and distributed it, and that was an issue. The reason that is an issue because we at the public health, we want to make sure that any food that is being distributed in public, especially if there has been in a truck wreck, we want to make sure that it was inspected by a sanitarian to make sure that the food is actually still good, and be able to either condemn the food or allow it to continue with the owner of the food. But in this case, there was a breakdown in communication, and that is what happens when there's a break in communication. Nobody called the department or the county sanitarian to report that, and it ended up in the public, and the public was consuming it without knowing whether it has been tainted, contaminated, or any of that. And that's something that we're working to try to prevent. And we're also building those communications, bringing all the stakeholders that are involved, so that if something like this happens, we should be able to get that resolved. And we also have another issue with apple trucks. There was a truck carrying apple that also had an accident. Nobody knows about it until it pops out on social media. People eating apples and talking about getting it from a truck wreck. And those are the things that we're trying to work on, try to resolve. And then on this competencies, which is advocating for political, social, economic policies, program that will improve health in diverse population. So in this, one of the things that I try to work on is the fact that when we were working on truck rights in terms of policy management, I kind of wrote an article on this, trying to be able to talk about communities or counties that are small and that lagging, are being underserved. So there is some kind of lack or inefficient resources for that county to be able to respond and be able to do the job right. So I was looking at some of the deficiencies in those counties, and then I wrote an article, and that was published on a newsletter pushing for a way to improve those policies in terms of economic, political, and social welfare of the smaller counties. So the Competence 15, where you evaluate policy for the impact of public health and health equity. So on this one, what I worked on, or what we have continued to be working on, is the fact that there's a policy, there's a rule, Montana food safety rule, that currently is ambiguous in terms that it doesn't really state what a hotel in terms of serving breakfast and all that. So it kind of let it open in terms of those hotels having to make their own choice on how they will be going to present. So as you can see, an example of the policy right there, that kind of is open, where it says a food service is operated, and then it kind of talks about the availability only to overnight registered guests or something like that. So what we're working on is trying to expand this policy to at least be mandate rather than optional in a certain point. So I worked on that, and we'll continue working on this improvement on this particular section. And I believe once our department is able to write the new rule, it will probably have to go to the governor and be approved. And then I also work on these competencies on 21 and 22, which is performing effectively on interprofessional team. One of the things I did on this is the fact that because I work in the health department and I have three responsibilities in my job description, which is public accommodation, emergency health preparedness, and then also talk about the truck wrecks and stuff like that. So what that means is if I have to try to solve an issue, there is a lot of stakeholders that I'm supposed to talk to. For example, when I go back to the truck wreck, we had a lot of meetings and a lot of communications and a lot of conferences trying to resolve the issue and see where there were a lot of miscommunication and down track on those connections. So that is what I actually worked on. So I work with a lot of stakeholders and a lot of teams from other departments to be able to resolve that issue. And then the 22, which is applied system thinking. So after we've covered a lot of those meetings, especially on the truck wreck, which is a very important topic, I went and created a thinking map, trying to connect all the stakeholders that are supposed to be involved in the issue like that. And I'm going to show you an example of that when I get to the appendix. So what my conclusion and reflections are practically is it was a very good experience for me in terms of being able to be exposed to what happens in the real world and having that opportunity to gain those experiences and have the knowledge of what to do in the world in terms of being able to run programs and run policy assignments in terms of that. So one of the highlights that I have on board here in terms of the strength and weaknesses is that because this is a new department for me in terms of experiences that I've always worked for, this was a little bit new for me. So there were a lot of things that I have to learn new, which kind of applied to some of the weaknesses that I have to be introduced to new terminology and new aspects of public health. But the strength on here is that I've already carried out some of the knowledge and things I've learned in this program in general in terms of program writing, presentations, and being able to drive communications and stuff like that. So I was kind of grateful for my supervisor for giving me the opportunity to be able and guiding me through some of the program that I did. So if I'm going to go through the appendix now and kind of present in terms of what I cover. So the appendices here kind of go along with the competencies that I cover, which was 14, 15, I think 13, 14, 15, 21, and 22. So if I go through the competencies here, you can see on the first one, some of the programs that I did. I went out there in a regional workshop, which is to talk about the budget period for 2022-2024. This was put up by the Environmental Health Emergency Preparedness Department, and because that's also part of my duties, I had to cover the food safety part of this workshop. So this is just the schedule and agenda that we cover. So it was a 2 weeks program working through all of these counties and covering those topics for those countries. answering their questions on how to complete these deliverables for them to be funded by the state. So this was my part of the job, to cover all the deliverables that had to do with food and water safety for the public health emergency preparedness program. And then this was the summary of all of the presentation that I did throughout the program. So I cover the sanitarian participation meeting for states to have their sanitarians at least attend a meeting for each year, and then review that truck wreck protocol to make sure that it is in place, because we'll be having that issue regarding truck wrecks in the state that sometimes we cannot miss out on the information to put in the database. And then they have to confirm that they have a backup sanitarian on their state website and also on the department update, so that if there's an emergency in that county, we can be able to reach out to the sanitarian. If they are not, you can reach out to the backup sanitarian and have them respond to that disaster. And then we have them also update contact information for licensed establishment in their counties, which include emails, physical addresses, and telephone numbers for each registered establishment. Because sometimes you have an establishment listing a PO box or listing a highway as their physical address, which we're trying to get those counties to be able to update that into actual addresses. And then we go ahead and talked about setting up a tabletop exercise for the county to test their emergency response plan in terms of food illness response. So if there's an outbreak in the county, how they're going to respond, and who did they have in that team, the coalition of who is supposed to be involved to be able to run those programs for them. And in the competency 14, I have covered some of this is also part of the competency 13, talking about the agendas on the workshop that I did and the presentation that I went through. And this is also part of it, talking about having those connections in terms of truck route, which departments are involved in that. And then the appendix B is the one I'm talk about writing an article on it, which was covering a truck wreck in the state and being able to talk about the database where we are in the states. I kind of make this map presenting where there has been a lot of truck wrecks since the highest numbers in terms of having more than 10 wrecks since 2016. So these counties kind of have. And then I kind of wrote and built a table of number of wrecks that are in each county during that period, and kind of presented that in terms of graph also. I made a graph to present those numbers in graph and as the way in tables. And then I kind of talk about, fine print, making sure that because we don't really have all of the data, you have to assume that it's not 100% accurate, because we're missing some data because some counties have not been reporting those information. And then appendix 2, where I talk about competency 15, talking about covering those communications and being able to get stakeholders and other people into my conversation. And then I have a table of a schedule that shows some of the presentations and some of the meetings that I have throughout the programs. I put that in the 2 months, the month and a half, starting out in April, where I started the program, and completing that in May and having those programs done then. And then looking at this appendix C, will have some of those rules and regulations that we're trying to get new application system of public accommodations and where they're lacking and how to improve them. So this is currently some of the rule that we're trying to have established a new rule, because right now as it stands, it looks like it's an optional thing to do. So we're trying to have that be mandatory thing. And this is some of the communications that I'm still having, trying to establish and have set up meetings to continue writing the new rules that will be approved. And then in terms of having the smart map and having those stakeholders, the connections, who is involved. So I made a map for the truck wrecks in the counties, in the state. So in the state, if there's a truck wreck anywhere in the states, so you will have someone that witnessed a truck wreck will call 911. The 911 will then dispatch, the call and will call the dispatch. The dispatch would then send out law enforcement, emergency management system, and fire department. So what happened is that this Montana Highway Dispatch is supposed to contact and send out a highway patrol. They go out there into where the truck is, where the wreck is, and then they'll go out to where the truck is, and then they'll call the dispatch and ask for a tow truck to come out and clear the highway. And then they'll also tell dispatch to notify the Department of Emergency Systems. So this department is quite responsible in case this truck wreck happens to be, let's say, carrying chemicals or that. But if it's carrying food, in terms of my department, if it's carrying food, the duty officer notify our Department of Public Health, and then we notify the sanitarian in that county to go out there and determine the state of the food, and then they can dispose of the food, or if the food was not damaged, they will do the assessment and then let the owner of the food have the food. If not, they will then write a report to dispose of the food. If this was a poultry meat and stuff that have to do with USDA, so that will have a USDA expert on the field to make those determinations. And then this was just the presentation that I built, that I've talked through and went through. So I kind of cover all of that already. And then the competencies that I kind of talked through, covering each one of those competencies. This was Appendix A, this was Appendix B, Appendix C, Appendix D, and E. So thank you guys for watching this, and I appreciate the fact that you are here to watch my program. And if you have any questions, please do not hesitate to talk to me about this. I'm open to have those communications and talk about the APA program and answer any questions that you may have in terms of this program. So thank you guys, and I'm out.